A question that we get asked a lot is, why am I waking up choking in my sleep? Or why am I waking up gagging or gasping for air? And if that's the case, the condition that you really need to be thinking about is obstructive sleep apnea. So obstructive sleep apnea is a sleep disorder usually associated with snoring, where your upper airway repeatedly closes as you sleep. So large parts of your upper airway are held in place by muscles, and as you fall asleep, these muscles relax. And as they relax, your airway will just naturally narrow in on itself. Now, the first thing that you'll notice is that airflow will become turbulent, and that causes these soft structures to vibrate, which we hear as snoring. But with sleep apnea, it'll actually narrow even further and actually close. And then you get this period of no breathing, which we call an apnea. Now, your body can only tolerate this for so long before it essentially sets off the alarm and pulls you back from this deep state of sleep to a shallower state or completely awake. So your airway muscles regain their tone, pull open your airway, and you can breathe again. But as they pull open, you can get that choking, gagging, gasping for air feeling that's quite unpleasant. Now, that kind of choking that you can get with obstructive sleep apnea isn't going to harm you at the time, but what you do get is extremely fragmented and poor quality sleep, because whenever you're getting into those deeper stages, your airway's closing and your body has to wake you up again. So you wake up in the morning feeling like you haven't slept at all. You're really sleepy throughout the day. So you're falling asleep in meetings. You're falling asleep as soon as you get home from work. And the thing that we really worry about is falling asleep when you're driving. But aside from that, it also makes a huge impact on your health. So it puts you at a much greater cardiovascular risk. So risks of things like high blood pressure, heart disease, stroke, things like that. High risk of diabetes. And you're much more likely to have things like depression. So it really does impact your quality of life. But sleep apnea is treatable. So if you feel like you're having these symptoms, then you must talk to somebody. There are other reasons why you can have choking and gagging in your sleep. So acid reflux is one, so gastroesophageal reflux disease. This is when you have a lot of acid in your stomach that can sometimes flow the other way up your esophagus, which is your gullet. And that can give you this kind of acidy, choky, gaggy feeling in your throat. There's other conditions. So if you have a lot of discharge from your nose, so not everyone knows, but these bones here are actually hollow. And especially if you have a cold, they can be quite full of mucus and other gubbins. And then as you lie on your back as you sleep, it can flow down the back of your throat and collect and trigger a bit of a gag or a choking feeling, which is quite unpleasant. So there are several reasons why you can have choking or gagging or gasping for air in your sleep. The really important one that you must look into is obstructive sleep apnea. So if you feel that you have this, you can speak to us or you can speak to your GP. But the really important thing is that you do speak to somebody.